Parents say that his teachers complain that he often makes careless mistakes, he is easily distracted, does not listen when spoken directly, he fails to complete homework on most days. As per parents, he often forgets his lunchbox at school, and these symptoms have been present since past 1 year at both school and home. And he has a special dislike for mathematics. Now, if you see from a distant perspective, from a third man's perspective, many kids are like that. They are distractible, they are distracted. Some of them are, they don't like maths. Some of you might not have liked maths. That is why some of you took up biology, right? And you became doctors today. So, but you have to focus that it is a group of symptoms where the examiner is taking you. And these symptoms have been present for the past more than 6 months, and they have been present in two different settings. Some of the kids will not be happy at school, but they will be happy at home and not having these symptoms. So these symptoms, similar symptoms are present at both school as well as home. So two different settings they are present, which makes a difference. Secondly, these children, the school grades are progressively following and the symptoms are becoming more severe as the time is passing. So this is affecting the quality of life in the child, and because the quality of life is getting affected, his grades are getting affected. So now it has become a serious disorder, and that is why there is no positive history in the family. All of this is pointing towards a diagnosis of attention deficit hyperactivity disorder. If you look at these symptoms, normal children can also be easily distracted. Normal children can also, not like mathematics. Normal children can also be easily, forgetting the homework or forgetting the tiffin box at home. But if these symptoms occur regularly, if they are present for more than 6 months, this forgetfulness, not paying attention, these kind of symptoms are present not only in the school but also at home, and they are severe enough to affect the quality of life, either at home or in school or in communication of the child or in development of the child. It is affecting the quality of life in the child. Then we call it as attention deficit hyperactivity disorder, right? Now you might be thinking ki sir iske andar only inattention symptoms are there. Where is the hyperactivity part? That is where the diagnostic criteria comes into play, that it can either be inattention or hyperactivity impulsivity or both. To define ADHD, there is a specific set of criteria. I will be teaching you the criteria. We will come back to this discussion, but for now, let us focus on the topic ADHD. What the key, initial things you need to know. So ADHD stands for Attention Deficit Hyperactivity Disorder. It is the most common neurobehavioral disorder in children. According to Nelson, prevalence-wise, it affects 2 to 5% of all school-going children. So it's very common. What are the three cardinal features of ADHD? Inattention, hyperactivity, impulsivity. You need to understand, not every child will have all the three. This is the major mistake people make. Sir, bacha hyperactive to hai nahi. Even if he is inattention, inattentive symptoms are present and these other criteria are getting fulfilled, you can still make the diagnosis of ADHD. The screening of ADHD is done by Vanderbilt ADHD rating scale. According to Nelson, this is the most commonly used scale for screening purpose. But diagnosis is always done by DSM-5 criteria, and there is a hypothesis. Their exact causes are unknown. Many hypotheses is there. It is related to dopamine hypothesis. What does dopamine hypothesis say? It says that reduction in dopamine activity in basal ganglia as well as prefrontal cortex has been shown to be implicated in producing the diagnosis of ADHD. This has been further supported by the use of stimulants. Stimulant medications are like methylphenidate are the first line drugs, and many of them act by increasing the dopamine levels in the basal ganglia and prefrontal cortex. But this theory alone does not explain the entire spectrum of the disease. There are other minor theories, but we need not go into the detail. Examiner can ask you dopamine hypothesis. Even in your OSCE exams, your Vivas, examiner can ask you dopamine hypothesis is applicable in which condition. If they are talking about a child, then it is ADHD. If they talk about adult, then you need to remember that dopamine hypothesis also is implicated in some varieties of schizophrenia, right? So this is ADHD where dopamine hypothesis is implicated. Now, what are the risk factors for ADHD? Or the associations for ADHD. It is seen that increased association of ADHD is seen in patients who have epilepsies. Increased risk is seen in tuberous sclerosis as well as neurofibromatosis 1. Increased risk is seen if there is a history of severe traumatic brain injury. In fact, about 20% of severe traumatic brain injury in the first 5 years of life, some of these children can progress to develop ADHD. Then, if there are psychosocial stressors, ADHD symptoms can be precipitated or worsened, and prenatal drug abuse history in the mother during pregnancy increases the risk of the child later on developing ADHD. So, these are the associations or risk factors for ADHD.